All Nagaland Pharmacy Association bra aji Kohima di press conference luigina Nagaland Sorgar bra Pharmacies kan laga license cancelled kora upar kushina pa janaiche. Association bra kushigi pharmacy license to Health and Family Welfare Department bra issue kusharo license nimide certain amount tishe kude license to 5 sal taka bichide renewed korea aro process to 2024 sal tak continue kushe. Department bra 2021 saldi registered pharmacist appoint kuribole order dia bichide state laga pharmacies kan cognizance lusharo pharmacy union panaisha kude union bra department ge qualified pharmacist committee takagarne diktari samna kora janaisharo time extend kuribole pindi krushe association bra diktari samna kora highlight kurigna krushege state de pharmacy institute na takagarne qualified pharmacist committee taka samna kuriase idrina hoigna association bra claim krushege controlling and licensing authority hisab Nagaland to behla state ase itu policy implement kuribole association bra department gilaf nai kushe hulibi itya homoy itu policy implement kuribole equip nai kushe.
First of all, I'd like to thank God for this time that given to all of us. Today we are gathered here with the party of Interim, All Nagaland Pharmacy Association. Before we begin further, I would like to introduce this my friend to you all. This is on my right, Lima, the General Secretary of the All Nagaland Pharmacy Association. Puluta, President of Kohima District Pharmacy Association. Tolibo, the Treasurer, Kohima Pharmacy Association. Sister Sikosa, the Assistant Chief of Kohima Pharmacy Association. On my left, Hyacinth, the President of the Parent District Pharmacy Association, and Michael, the Secretary of the Parent District. Today we are here to highlight some of our grievances to the government for what is happening around here in the many part of the social media. Also, I would like to thank the media friends for coming and covering up of this particular time. The reason that we are here is like we have got something to tell to this, even to the government and even to the public for what is happening here. The issues as they reach us, they have given the show cause notice in the year of 2021. So from 21 onwards, we are dealing with these issues till today. We would like to make it very clear to the people of Nagaland that these issues is not only 5 years, 10 years. These issues has started from the time of since the existence of the Nagaland states. So it has got these 40, 50 years issues is there. Now with this, the 40, 50 years of the issues that we have today, now the states is the shortage, the state is facing of this one, and where we have this from all over the 14 district which is affiliated to our association today. And because of this, the transportation, because of this, the weather, the other district could not turn up. Only this around here could able to be here this morning. As we said earlier, these issues that we would like to let our, the people also to know, something like we are doing for the people of Nagas in general as a whole. We are not doing just for this business, but this is our service that we also been contributing to the society. Our contribute, instead of acknowledging of our contribution, now we are facing this kind of thing. Now many pharmacies across the states have been closed down because of the the show cause notice and the cancellation order. In later on, all these details will be, briefing you. As we said earlier, these are some of the further. I will give time to my secretary to highlight some of these the thing which has been, the said and written for all of us today.
Okay, first of all, I'd like to thank the media fraternity for covering this event. Now, in the first place, we want to portray our grievances as well as our, the conclusion that we have come to after going through in-depth study of the matter. So I'll go through the points one by one. So, now we all know that in February 2025, the issue of closure of pharmacies without pharmacists came to the fore and got widespread media coverage and scrutiny. There were many instances where the pharmacy community was demonized. We were even portrayed as running our pharmacies illegally, which is not factual. In fact, we are also a victim of the corrupt system. The general public as well as our media was made to consume only one side of the story. NBA could have, but chose not to react at that point of time. That is during February-March. Instead, we decided to have an in-depth study of the ground reality as well as the implications of the department's action on the overall health sector of our state. Now, I want to stress on this because in the tussle between the department and the pharmacy community, it will be the general public that will suffer. That is the point I want to stress. Now, at the present point of time, NBA has done our bit. We have called this press conference so as to provide facts and figures and our side of the story for public consumption and cognizance by the Department of Health and Family Welfare as well as the Government of India. Now, I've said that we are also a victim of the corrupt system. Now, why I'm saying this is the point. Now, how the pharmacies are run in Nagaland? How are the pharmacies run in Nagaland? Because it is not a vegetable shop. It's not a vegetable shop, so we cannot just blindly open a pharmacy. There are certain systems we have to follow. Now, the procedure that is in the system, the system that is being followed by the department is our pharmacy licenses are issued by the Health and Family Welfare Department, wherein they provided the name of the registered pharmacist and their registration number. We were asked to pay a certain amount for the license which each licensee has paid. Then the licenses were renewed after every 5 years. Renewal fees are charged from each licensee. This process has continued till the early part of 2024. Now, moi ade kiba ita bole mona ase. Moi ade license ita thikai dibo. Itu license te apni video bar cover room ma chale dibi. That will be very good. Yade department ba dia dole SR Chaudhary is a pharmacist, person qualified in charge to look after this pharmacy. His registration number is 334. Now, system to kina thaki sigulelo, we are laymen. One layman ase. Our one ba jania takule Department of Health and Family Welfare ba moinge edo pharmacy license to di ko na man jani lusi. So what we did is when application likhina jana department ge, we asked for a license, a pharmacy license. When jana edo dise department ba ki korise time by itu ready কৰি দিছে আৰু after a few days অলপ দিন পিছতে আপুনি লা লাইসেন্স to ready হৈছে লবলে ইনা হৈছে আচ্ছা ওনা মই যাইছি চাইনা মই লাইসেন্স উঠালে লাইসেন্স লা ফি দুই ইমান হবলে ইনা হৈছে মই নিদু দি দিছি now department bra মই ইদে জানি আছে দে মই ইদে জানি আছে the actual system is when applied rather than when asol duile when pharmacist last certificate luina jabo lage. Department never asked us for a certificate. Only then nami likhina disilo to moin to bhabise maybe the department assigns someone to look after our pharmacies. to when itu ba follow guse. Ina ona when pharmacy to run Grievances. That is the reason why I'm saying that our business is not illegal. We have been running our pharmacies legally run Grievances. The other point I want to stress is, media general public department is claiming that since 2020 ba itulah notice to dia suru usi. Holy when pharmacy community knowledge the first notification we got was in September of 2021. Yet I want everyone to think about retention certificate in my hand. This is the retention certificate of a certain pharmacy that is provided by the department. Now, itulah retention certificate it was given in 2023, and this license is valid till December of 2028. To department 2021, 2020 ba itulah pharmacy bond pharmacist to mandatory hobo when atin janina hasu bilelo. Why did they issue it? It retention certificate as it. They issued new pharmacy licenses even in 2024. Now, how is the department functioning? It was a big question that that is the reason why we are saying we are a victim of the system. We are a victim of the system. It does it. The other point I want to stress is Department of Health and Family Welfare started issuing orders to the pharmacies to appoint a registered pharmacist in the later part of 2021. Pharmacists in Nagaland took cognizance of the order, and hence pharmacy union was formed in each district, and efforts were made to appoint registered pharmacists, and at the same time representations were submitted to the department citing the difficulties faced by the pharmacists due to the shortage of qualified pharmacists and appealing for extension of time. When the 2 months, 3 months in our department extension to it. Of course, the part we acknowledge. But when the department started implementing the policy with earnestness, the need for a state-level association was felt necessary, and hence, all Nagaland Pharmacy Association was formed on the 13th of March 2025. Yadi ekta one clarify problem munjado, itulah issue nula naktuile Nagaland de pharmacies kan affairs kan tuile Nagaland Medical Dealers Association bra. So, say but when this issue came to the fore, when NMD giving one approach to it, but time initiative to we were not satisfied. They didn't even go for a single consultative meeting of the other districts. So what happened was that the issue was going on. The closure of pharmacy was at hand. So what we decided was that we have to stand on our own. Itulah understanding bra on the initiative of Kohima Pharmacy Union when state kanji mati luise inauna Nagaland all Nagaland Pharmacy Association though 13 March 2025 the form gulise. Still now Dimapur Sumagadima aro Newland doile NMD rai rukhai na ase. They are unable to join us. But we want to send this message to the NMDA that we have no differences with NMDA. Our goal is the same, so that is the reason why we appeal to NMDA that it will be much better for all the pharmacy community if we can work together. When it will message we portray when NMDA come NMDA as a first step approached the department and submitted a representation to the principal director and the controlling and licensing authority praying for a reasonable extension of time, but the answer we got was negative. Therefore, we decided to approach both the department as well as the government. We therefore submitted another representation to the Commissioner and Secretary, Health and Family Welfare, but again, the response was negative. Then we have submitted a representation to our Honorable Chief Minister of Nagaland, and the response is still awaited. We have also approached our Honorable Minister of Health and Family Welfare, but we were denied appointment. We therefore send a representation to the stenographer to our Honorable Minister. When Bhabishe Health and Family Welfare Minister to since he represents the whole Nagaland, we thought that he will be the right person to approach. Ito ang when man approach ko ulit try he is reluctant to give us appointment. Even his senior BS is reluctant to meet us. Maybe they are too occupied with some other works. We do not know. But I think we expect our concerned minister to at least meet us and hear our grievances, whatever be the outcome. We have also been trying to meet our chief secretary, but is yet to get an appointment. Chief Secretary, even when Bishibar ko ulit try to appointment na. Now, at the same time, when ito kure na representation kani diyan na on an individual capacity as well as organizational capacity, when pharmacists to appoint really try to when actually model kure na appoint really try to but the fact is Nagaland does not have pharmacists. Nagaland does not have pharmacists. I will come to that point later on in more detail. Polibi when Achida TV when she's successfully employed when Achida TV. We are putting in our efforts. Now the department at some point of time has claimed that we never took cognizance of their notice. No, we have taken it very seriously. We have taken it very seriously. That is the reason why organizations were formed. And we are putting in efforts. We are putting in efforts. Polibi subji na thaya na manso na bagay na manso lode bat khabi bole do ito to bishi problem damor one is na hoje mo na problem do. We don't have qualified pharmacists in our state. Enough pinoko. We don't have qualified pharmacists in our state. So itulah situation when they are forcing us to employ a registered pharmacist at any cost. Now, how do we go about? Are we ready when point stress if the department can, think about the matter seriously, and since we are also stakeholders, if they can invite us, maybe together we can come up with a workable solution. That is also an appeal to the Department of Health and Family Welfare. Now, the other point I want to stress upon is ANPA fully understands the requirements mandated by law and we are willing to abide by it. When pharmacists narakibo now only we are coming to know that mandatory as a pharmacist to rakibo lagi. Well, we want to employ the pharmacists. But give us some solutions. That is what we are asking. That is what we are asking the department. Now, this is also very important. See, Nagaland being the only state in India without a pharmacy institute is faced with acute shortage of qualified pharmacists. India being a developed country with inadequate manpower to mitigate the shortfall of qualified pharmacists has even introduced diploma and farmer produce enough pharmacies. Moreover, no state in India has thus far successfully implemented this policy. In fact, according to our controlling and licensing authority, Nagaland is the first state trying to implement this policy. Now, yadi ekta kata ase. Nagaland even union directories to be sought the pharmacy institute ase. Nagaland is the only state in India which doesn't have even a single pharmacy institute. And even the Nagaland government is unable to send adequate number of students to study pharmacy courses on government quota. Now, what is their plan of action? How do they mitigate the problem? Because they know very well that there's a problem. But we don't see any efforts on the part of the department as well as the government of Nagaland to mitigate this problem. Sabi, advanced countries can, European countries can kikian dito diploma in pharmacy noloy de. Time la minimum qualification to ile bachelor's in pharmacy ase. Only India to manpower nahi though. India is still a developing country. We don't have enough manpower. Itu ba dan pharmacy diploma in pharmacy course be introduced kori dise. But still shortfall to ile bishi ase. Other states, ajikali to Google kori shikole sob ka channel lo. Alag states kan de saisi kole to Andhra Pradesh, Maharashtra kan la de saisi. 50, 60 institutes. There are 50, 60 institutes in those states. How many pharmacies are they producing each year? Nagaland is the only state without a pharmacy institute. So government la plan of action to be clear. Our still other states can one pharmacy institute thagili then it to la policy to implement go na parna. No state has successfully implemented this policy. In fact, in some states, the matter has been litigated. It is under litigation. So, Nagaland itu lah condition tadi asyik usia beliau. Our controlling and licensing authority has proudly told us that Nagaland is the first state to try to implement this policy. Are we in a position to implement this policy? I think it's a big question that the public deserves an answer. Public deserves an answer to this. Now, if you look at the ground reality based on various data, the ratio of pharmacists in Nagaland to the number of pharmacies in Nagaland to the number of registered pharmacies is quite disproportionate. As per the data provided by the department and published by the Nagaland Post on the 14th of February 2025, there are 1,157 pharmacies in Nagaland. Ito pharmacy khuli na thahan niya side. License lui na pharmacy no khuli ando kiman 1,000 ho ito to when kuha na paro. Ito to data collect possible ito. I don't think it will be a small number. Whereas there are only 278 registered pharmacies according to the Department of Health and Family Welfare. Now, let's work it out. Time per Nagaland Post kuha isap dito, or Nagaland Post publish kuha isap dito, 1,157 operational pharmacies in Nagaland. Whereas time per data provide kuha dito 278 registered pharmacies in Nagaland. Out of 278, 252 the government employees are there. So, government employees cannot run a pharmacy. So let's put them out of the picture. Now, how much are we left? We have 26 pharmacies left in Nagaland to look after 1,157 pharmacies. Ito ito when grievances ito aspect. I think this is very important. Impact of the policy on the public health sector. And after thorough analysis of the ground realities of the view that if the government is to implement this policy in its entirety, will put the public health sector in complete disarray. Here are some data in support of our views and for the consumption of both the general public as well as the department. Even in Kohima, the state capital, some colonies like AG, Merilita, Leary, etc. will be left without a single pharmacy. How is that one Kohima la where is there? Our AG colony, the largest colony in Kohima. Government pharmacy so to shut down go disibelido. Leary dito ekta pharmacy ni nabachibo, Merilita di ekta pharmacy ni nabachibo. AG colony di ekta pharmacy nabachibo. To itya stop ekta 18 rupees for kinule colony la pharmacy di kini thado. The nearest place they can go is PR Hill. Just think of the inconveniences caused to the public. Our rati bimar ekta hosi kiba ekta hosi bole even basic medicines be dibo na parule. Even a simple headache probably manu muri jai. Holy suddenly rati di bimar hosi bole to kut par lobo. Morning no hada isorde morning pra mugi morning dak no morai diide wena ro khaibo na ye. Ito last situation ekta dia ase. That is about Kohima. let's look at the data of some districts. Melori, Shamadur, Phe. Melori de presently 6 pharmacies are there. Pharmacy 6 are there. Tade ekta bhi registered pharmacist nai. Shamadur de 4 pharmacy are there. Ekta bhi registered pharmacist nai. Phe district de 34 pharmacies are there. Tade 2 in-service pharmacies are there. So in-service pharmacies can do time license to cancel grow lage. So just think about this. Melori, Shamadur, Phe can do le whole district without a single pharmacy run grow le. Public la health to kila position ekta de rakhi dibo. So the district headquarters are there. Now think about the subdivisions and rural areas. There will be complete chaos. There will be complete chaos. Now we want to ask the department, the wider question is the department in a position to fill the vacuum? Time pharmacy so bon go. To time na policy to kiya ase. We are going to close down all the pharmacies, and in the meantime we are going to do this so that the public doesn't suffer. Time ito na point of action ekta bi ase na ne. Time na concrete policy ekta bi ase na ne. I don't think so. Now another point we wish to stress upon is that there is no case in Nagaland where a patient's life was either lost or put in jeopardy because of wrong medications administered by any pharmacy. In fact, everyone must refresh our memory and think of the services provided by the pharmacies during the recent pandemic, that is, COVID-19 pandemic, when the department or the government was in no position to even provide basic medicines to the general public. Now, at that point of time, the burden and responsibility was borne by the same pharmacies that the government and the department is trying to shut down. Ito na buwan, so public, general public view, kun bravi nuhi kuwa na parwo. COVID-19 to kila situation na yun. Pharmacy and thake na yun kuti jawa na yun. Was the government even in a position to provide even basic medicines? No. What if another pandemic comes? Transition to smooth wall lagi though. Transition has to be smooth. There must be a solution. There must be a solution. Of course, we are not saying that the policy is bad. Nagaland has to move forward. Nagaland has to move forward. So of course, changes has to be brought about. But these kind of drastic decisions will put a huge vacuum in the public health sector. That is what we are observing. Health is a state subject as per the constitutional provisions, meaning any state can frame health policies that is relevant and applicable to their state. Then the question is the government of Nagaland and the Department of Health and Family Welfare Department equipped adequately to step in and fill the void? Now, I want to ask the department, do we even have a Nagaland-specific health policy? If there is, make it known to the public. But I think the answer is a big no. Our government is unable even to appoint qualified pharmacists in all the government-run health units. Now I want to provide some data here. Public health units. Government-run public health units, TV department pharmacists, sufficient pharmacists appoint grow na parnas de. Mon district ikpa sawo. Sub district na zawoli mo kunwa district la data di dibo. Mon district is Shangyo, Oding, Wanjing, Angbang, Mopong, Yongkao, TTC Mon. Ito ang the government registered pharmacists appoint grow na parnas de. Phe district e wo. Semo Phe, Chief Medical Officer Phe TBA, only 2 pharmacies are there, whereas the sanctioned post is 3. Tadi bisa choto, Tetsome, Kuzame, pharmacies na. public health units to police only pharmacies appoint government. Melori the pass over. Poor, Lepori, Baziho, Akiko, Sitzu, Hutsu, pharmacists nine. So if the government, even the government is unable to appoint adequate number of registered pharmacies, time the solution to key. So in the meantime, what the government is doing is to solve the problem. What the department does is to impart a 3 months training to the nurses, and now the nurses are dispensing medicines to the patients. Should the same yardstick not be applied to both the pharmacies as well as the government-run public health units? So time na public health units the pharmacists appoint group na parewa 3 months training course di na nurses can give medicine dibuli dia siguro. They are not registered pharmacies. Should the same yardstick not be followed to both the pharmacies as well as to the public health units? Time the pharmacists na thagya ba appoint group na parina sinagi. तो तारो appoint guru na bare aru main jeta job por justi apni to kut bahuli appoint guru lage etu ekta asile. Now NBA is of the opinion that the department can come up with such programs if they have the will and are concerned about the public health. When is time certain policy, state-specific policy in the meantime, when shortage of pharmacists face product to a certain policy implement let the transition be smooth. Now in conclusion, NBA is not against the department or the policy in question, but we are of the opinion that Nagaland is not equipped to implement this health policy at the present point of time. We are hopeful that the department would come up with some workable arrangements till such time our state will have pharmacy institutes and sufficient qualified manpower to provide healthcare to the general public unhindered. In the meantime, we appeal to the department as well as the government to allow us to operate our pharmacies till such time the department comes up with a concrete health policy that is relevant to our state and that the public health care is not left in a vacuum. We assure that on our part, all our efforts, both individually and on an organizational capacity, shall be made to employ a qualified registered pharmacist. So, when in conclusion, when last day we appeal problem on us, when we trying to run away, we have done our best, we are trying our best, and we shall put in extra efforts in the days to come. But we want both the general public as well as the Department of Health and Family Welfare as well as the government of Nagaland to look into the matter seriously. And come up with a workable solution for the interim period till such time when we have enough pharmacies to take the mantle. So that the transition will be smooth, the public will not suffer, and everyone, irrespective of whether someone lives in the cities, towns, or rural areas, will get at least basic medical service. That is what we appeal to our department. See, first thing is our state needs institutes to produce enough pharmacies. Our state needs enough pharmacies. Now, institute thakibo lagi do. Institute the pharmacists, qualified pharmacists kan to pass out kuro lagi do. Now, only state the ekta institute pinay pharmacist institute. Government at the most they can send is each year state la kota di 5 jun 6 jun ki pharmacy la process puri ule hota aise do. Na. So every year, let's say that every year government is producing 5-10 pharmacies. But at the same time, if pharmacists retire, the number is not increasing. It was a problem though. Pharmacists 9. We have inadequate qualified registered pharmacists. That is the main problem. It's not that we don't want to employ. We want to employ. We want to save our business. Because this is not just business. Okay, of course, there might be some rotten apples. Rotten apples can be taken with a community. We are not denying that. Only most of us, when we do business run, it is for our sustenance. When it do our family survive, on top of that, we are also providing service. When it is there, when this is unlike other business, this is an ethical business. When it do thought Pukina when Puride. Thousands of families are dislocated. Thousands of families are dislocated.
Just a supplement of trend. What I want to know is, since you are saying that there are no qualified pharmacies, no, but so how are the pharmacies being run? So without a qualified pharmacies, so how are these being running? So how are they providing the medicines to the people?
Actually, in Assoc, when one is in Nagaland, the first place where department will strictly implement ICW, no pharmacy would have been running without a registered pharmacist. When one is in department where you do license, ready-made license, this is the one there. Now, of course, we were ignorant of the law. We admit that part. And ignorance is not an excuse. We also accept that. But that was the system. That was the system. Because Nagaland, the pharmacist and pharmacy license to the tribunal Nagaland deliver a interview and the controlling and licensing authority tribunal form then based on experiences. 5 years experience, 10 years experience, it 1 year. Thank you, pharmacist certificate. They were appointed as pharmacists, as registered pharmacists. Paramedical Institute TV 2 years course is introduced. In our, it's not diploma again. Certain policy in our then it will mitigate growth they produce a huge number of pharmacists through that course. In our Julina to government to pharmacy to pharmacies can be run globally out of question. So presently most of the pharmacies are running without pharmacists. It's either based on experience. Bishiwala do le ekta pharmacy de buwo. Tadiba experience can go, doctor knowledge can go. In our self-taught as it. Self-taught as it. That is how our system is running. Like you pointed out, we are asking for extension of time. Now, in the meantime also, we are not just going, when any representation being we sit with them, we try to talk to them, When the time Bujubuna Yedulabi when approach created. Now, in the meantime, when the expectation be let's come up, let's sit together. Let's discuss the matter. Let's discuss the matter in depth. Our ekta solution ekta animo try go janna. Kile mani sabe. Ikta Nagaland 700, 800, 900 pharmacy pon gurisi bolido. Ultimately public is suffer go. Now public is suffer go. Ituba yes. We need to move forward. We need to move forward. Kung sila Nagaland pulay na sila when pulay na sila ito la system din tayo ito noy. We need to move forward. But we ekta move forward ko nito. Government come on, let's sit together. Ekta transition ko nito ekta jalna ekta solution ekta bisar ko jalna. Na let the transition be smooth. In the meantime, mo hindi pare that research pharmacists to employ group. Now, our department Ravi, come on to your base, bring pharmacy institutes. Ek time na duita din na ajikali to private institutes can be anibo parwo. Anina institute ekta na jana alag state kan ye pit ko na pasta chuida ani na ina na produce enough pharmacies so that the transition will be smooth. If and when the government comes with such a policy if and when the state will have enough pharmacies, we don't need the government to ask us to tell us to close down our shops. We will shut down our shops on our own, voluntarily.
Adding to that, itu pharmacies to shortage while majority bi ite do ami kan ki communicate kurado bahar bra itu pharmacies kan anya kan to itu bi bom aja si ite do ite bi komti nai bi nai ini ko ha majority ite do apni bahar bra bi pura manu ki certificate bi ani kine cholibo na paribo to ami kan ko to bra cholibo ami kan itu karne agide sadi ko ani sinami kan to goro itu department ki ko bole mon thake do itu time to aro extend korbi na iniga hoshi bole ami kambi itu time de kiniga hole de paribo itu la bi bisaribo do iniga bi na hole ami kambi kiniga gurubo ami kan aji du iniga hoje se itu bara aji du so ai gini iniga ko tha porese de
Because just asking for time extension.
bisaribo ami kan
Bisaribo to night to depo de bisaribo.
Tadi na, tadi mo ita point ite shares ko mo na si. Mo ka of course mo kiba gradually na si. Mo extension of time mangi ase itu ita. So that we will hunt further. Na, we will hunt for pharmacies. Decision by ase de, achieve kalibi action decision to ini by na na. Ina na decision by ase de babi. Aro mo department give approach ko sabi itula problem ase. There is shortage of pharmacies. Why not in the meantime awan na ita come up with certain courses na. Ita course ita kiba ita introduce ko na unian. We are even willing to pay for that course. Na. We are even willing to pay bear the burden. Transition ko ulit. We are also losing our livelihood. That is also one thing. Of course, that is not the main point we are stressing upon, but point is a solution to bisarong immediate. Ekta course can be introduced ko really key. Point is na department by pharmacies appoint group na pare ba 3 months training course din na nurse can be PhD de tawai di ko diya silo. Na, if the government can come up with such kind of policies for a certain period of time, we are not asking for 20-30 years, okay? We are not asking for 10-20 years. But in a few years, immediate transition go on, immediate our state will also have enough pharmacies in the meantime. Na, aru when immediate when la likelihood as it here. Ito la business to na. When la likelihood pi as it. To si when you time si when be pharmacies appoint group parle group no si when be alak business kan di transition group le na transition period to extend go na ito go as when go le.
One question you're talking about is set for the extension.
No, we are not demanding for 3 years, 5 years, or 10 years. But we are appealing to the department to give us a reasonable period of time. Reasonable.
So what is that reasonable period of time according to your association?
That is what we are saying.
Until such time, the government is ready with qualified pharmacies. Because I just want to come in here. Pharmacy, how you are running with a qualified pharmacy? We also admit that we are running pharmacy with qualified pharmacies. Only necessity is the matter of invention. One is not the needs of the hour, the needs of the time, compel us to choose this profession. This pharmacy is a novel profession. We are not just jump into this profession. Only be looking the needs of the town, the needs of the area, our area. Pharmacy nine. I myself will suffer. So why not we find some solution? Maybe medical field is medical company they come with I'm just taking an example. For a few years, then I got experience in medical things, then left that company and back home and started pharmacy. So So India guna my bosti manu kibe mala town mala yati manu ki mudu puna. Still now I'm running more than 20 years. I'm running pharmacy. So experience to judge. Though I don't have that qualified pharmacist qualified administrator certificate. Not a pharmacy holder, certificate holder. Likewise, everyone has their own story. How we come into this pharmacy profession. Itu need based dia mahana ina join kuna kani. Assault to in this pharmacy mula former speaker doesn't so bal probably details if I don't go explain. Believe we are not just doing a business here. We are also trying to bring some change and try to help serve the people. Pharmacy business it is something like not like other business. Itu karena amon aru obnikan ni jani they are just compare with other business. Pharmacy business is running with full discipline. Our rules and regulations bishi ase. Today we'll have to maintain the stocks, temperature, guidelines. We are observing, we are following, we are obeying all the rules and regulations. India guna thakatu, India amohan ki itulaga issue ulai dia tu. Actually, it is not an issue. Yade public here misunderstanding present. Only American. It is not that we are cooperating with the department also. We are trying to cooperate with the department. Only that here department kwanto amohan ke. Your pharmacy cannot be run without pharmacists, experienced pharmacy, and it's a qualified pharmacist. So, it is Amahan to Google, did I pull up with this yet? Documents, everything is perfect. The license were issued by the department only. To Aman Google, the criminal is not frequent. To Amana Goltiki, as we don't have a pharmacist. And we are also trying to bring out to come with the pharmacists, like we are money beside. To state among Nagaland state the conditions I should it number to go ground ready to I we don't have a pharmacist, qualified pharmacist. Night Hakatu Tagaze 278 because it's probably one figure part into Pache. To Tahani maximum to the government and protection. Napura 26 1 26 it to be to the master in pharmacies, doctor in pharmacies run as they will go for another job. So pharmacy they go away. 7-8 lakhs खर्चा करना किन्या pharmacist तो इतना बोले मोनो तो इतो करे तामी willing भी ना है तो हमारा state अमन बिचारे से ना पाए तो इतो बराती कैसे एलिगा होले कोई ना अमन दूसरा state भी अमन convince करना आने वाले कुछ ताहे ना आये वाले मना भी convince करना आये वाले करने again the department said will not allow from outside तो where do we go एलिगा से आते कैसे तो pharmacy is not the only way of survival तो अपन बंद कर दे वो करे public to suffer करो तो हमें बंद कर दिया इधर ताई बंद कर दो वहाँ सब बंद कर सकते हैं कौन सफर करा दे ना ते वहाँ सब पब्लिक सफर करो तो किले करे इधर सभी किले का उपाय इतना करना भी अपने से बोले ग्रीव वाले दे मानो डॉक्यूमेंट्स लगे ना फार्मेसिस्ट लगा इधर डिग्री होल्डर का D-Farm का सर्टिफिकेट तो लगे ना हैंग करना सकते हैं only with the person is not going to sit in the pharmacy all the same person is dealing with the medicine only the certificate is hanging in the pharmacy. Israel no. So itu justify group orang mana? Itu no itu. Itu berapa? Moi kau tu moi tu interest ni itu problem. Dari na kau tu moi no hai kulen naik, moi na parai kulen naik cari dulu. Boleh bi? Itu jadi na bisari bo pharmacist, bisari na adi bo tadi hang group bo. Itu manu ke have to pay another 10, 15 to 20,000 extra for that documents only. Whereas the person is still willing to sit in my pharmacy. Aru ni boa bin the boy boleh. Itu thake isi boa bi Dimapur Chumu itu ada sabi. Bisi waktu itu just certificate hanging there. The person not there. Ideal context India police. So ground ready to sign up now department they don't have to run corner to corner, they don't have to enforcing this. Itu nakuribi corner. Iman dupi guru kam na. Jadi government para diploma dosra B-Farm na no at least diploma institute is na ita. State ke ani shekule. Every year 200, 100, 200 pass out shekule. Within 2 years diploma course 2 years ase. So 2 years te 200 to 100 within 4 or 5 years they pharmacy से बोलता हो जाओ diploma पढ़ना ताई खान निजे ही बिसारे की ना जाए आए जाओ pharmacy दे we don't have to go looking for them they themselves will come और वो pharmacy दे occupy करो तो इधी काला situation ना हा तो itu एक तो fully implement करो we are in bit in nature टासे मोना state का condition तो government भी दरा weakness जाने वाला है खाली pharmacy के blame करें ना और public खान तो ना जाने pharmacy खान सब बंद कर दे itu kan itu kam nahi na 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 boisi itu boisi bi kun te at the end of the kun suffer karo public suffer karo amala district ite aap ko college na there are 8 health center community health center, আজিকালি health and welfare center 18 district, 18 sub centers. They are supposed to be pharmacies. We are not condemning that GNM, they are not qualified. They are qualified in their field, but they are not supposed to handle the medicine as per the Act. The medicine dispensed only pharmacy. So the nurse can be from like BSc nursing, MSc nursing, I can qualified as they by the Act, they don't allow.
Government appointees as a Holibi general public honey buhiaje, Takanto appointment to Eta alak, Wahadu Mano alak. Inihalakabi Muhala evidence as a one over there. Na government you kitia to department itu lagi si boleh muhandi itu kan so ready as a Amikan takal lobote ki bisi udishe, Amikan department lobote ki ka boleh ball hobo, lekal lagi Amikan lobote bisi as a itu kandu department ke dishe, department ke itu kami answer muhangi dibi. Itu kandu mohan itu kan lagi. Department beradu takkan lapale pada information dia se. Takkan dia laga aru kuala do Allah ko jesi. Newspaper dia ko je more than 300-400 unemployed pharmacies as 300 people no according to department ratio. To ami kandu ko di jabu itu tu. Takkan action aibo kiba-kiba ligi ini public ke pakala kori dibo. Itu laga na hoy do ite tu bal bara agi de condition na bal bara kuri gene ami ka step to forward kurubole laga time mo je itu bara ami kan aji ite thagya do agi de kuse ami kan do department laga against na de ami kurubole ase ole bi kini ka bisarubo rasta ami kan gibi dekabi aru ami kan gibi mo to kuribi to ale ami kan do department mara mang expenditure be kuribi ko na hoy do rasta kan ami kan ge dekabi to ami kan bi bisarubo kurubo do Olympic Banish na ito yung negosyo, to ami hang ko de jabo. Imang family do ko de jabo. Ini ang concern tagya bra aji ami kan ide hisde.
Mo yan na. Odola question de previous question de mo ita answer di mo mandalo na. We are not asking for a specific period of time. Only we are asking for a reasonable extension of time. When kile reasonable do kuisi beli do. When we are all stakeholders. There. When Japon that is not the solution. Public suffer war. To when reasonable solution iktado when opinion dito inase. We are all stakeholders. Pharmacy community, department, medical experts. We have medical experts in the field of medicine in Nagaland also. If necessary, invite from outside. In Abigwana, let's sit together, look at the ground reality. Now, what is the reality in our state? In our government, come up with a policy. Policy ta aniwe. Sabi, 5 years kami do mo institute iman kiba guri dibo, ina guri dibo. Mo itu solution ani dibo. Ina ita guri na ikil wote work out possible. The public will not suffer. Transition will be smooth. Our state will also move ahead. Itu aside kota to. Ito no issue ulido, ikiala do solution no ito. Of course, we'll lose our business. That is also one thing. Let's leave it. Only public to muen Kohima dimabor kandi thagiano na. Iman seriously do na pauyuli kami. Only mue itia figures ko naman diarin isna sabi to. Meluri district ki 6 pharmacy thagisi, 1 pharmacist na. So all the 6 pharmacies will be closed down. On top of that, public health units TV, correct. 1, 2, 3, 4, 5, 6. 6 dito 9. Or so Venice dito public health units fi na. To siguro Meluri gando ele matha biga siguro jao kali hayo we. Pekti tawai inuli jao. Pekti be pharmacy ka jao na na pa jao iki jane. To jao na ina nukuribo. Na public pi suffer nukuribo. Ina na solution, permanent solution ikta bisar boli do. I think it's up to the department. And that will be our reasonable period of time. The solution that we come up with, the solution, the roadmap that the department comes up with will be the reasonable period of time for us.
What plans do you have?
No, see, as of now, we don't have any such plan of action. We are not going to come out on the streets. We are not going to resort to some violent actions. We are not going to resort to any violent actions. But we want to knock sense into the heads of the department officials as well as the government to face reality. To face reality. Because Sati Bhagwan is enough. Invention is the mother of needs. Nah, according to our needs, we invent. Nah, we innovate. We innovate. To tell na, a certain period of time, in the meantime, a workable solution, workable criminal, it appeal. We still now we are only appealing.
We are not against the system. We are not against the department for what they are doing. We only request the government or the department to look beyond the words on the paper. It has one thing. Only paper the key say to implement na remove ground reality say na amanti come behind us. Just see behind the hearts behind our work. Amanti come guna say to be